Well, hello, everybody. Happy Wednesday if you are joining us live. You will see that I'm joined by my colleague here, Kathy Beach, who has been a health coach for decades at this point, integrative functional medicine practitioner in those practices also, and has a particular area of expertise on cancer risk reduction. And we're going to talk a little bit even about who we're talking about when we talk about cancer risk reduction. But before I go into that, I just wanted to share that today's session is primarily to introduce you to our cancer risk reduction program to help you understand what is in the program, what it offers for you, your patients, prospects, clients, etc. on that part. And any questions that you have, we have Kathy here who helped us. She's our collaborating partner, our expert in the development of it. What's really fun about this program is that it also goes through and uses a lot of our other BNP tools. So those of you that already have some of the tools, you'll see how we're using them in a programmatic fashion, and that may be helpful for you. If there are additional questions that come up, if there are things that you have questions about from a business standpoint, etc., I will try to leave some time for that, and feel free to drop any of that in the chat box. If you like what you're seeing, we always love to see hearts. Thank you, just on prompt. If you have anything that you need from us, let us know. And just a reminder, I can't actually see typically the name of who is commenting. So if I say, hey, Facebook user, great question, it's because it just says to me Facebook user. So apologies on that front. If you want to announce yourself and say like it's Susan or it's whoever when you're asking a question, then I can speak to you personally. Anyway, all right, Kathy. So Kathy, for those of you who have been a part of the membership, part of BNP, has been here with us from the beginning. And really since the beginning, we have been having conversations about how can we bring better cancer risk reduction support. And really, this is something, a lens through which so many people are, we know, obviously, the millions and millions of people in the country that are affected by cancer. And by affected by it, it may be the individual who themselves has had either a concern where they've been, maybe they've gone and had to get a biopsy or something else, and it turns out it was benign, but it's a wake-up call for them, or they're concerned about that from a risk factor. There could be individuals who have had cancer and they're looking to reduce the risk of recurrence. And we'll talk absolutely about that and how this is a great program and maybe the timing for when this is a good program for them. There are others that, like so many of us, the wake-up call, unfortunately, has been friends or family members who've had diagnoses, people that we've lost, people that have maybe been fighting and are continuing to fighting, and people who are surviving. And we're saying, like, hey, how do we help our body really, give it as much support? And so notice that we're saying cancer risk reduction. So this comes off of the heels of our cancer risk reduction tool that we developed in conjunction with Lise Alschuler, who's a naturopath who works with the Arizona Institute for Integrative, I'm making up that title. It's the University of Arizona's Integrative Medicine Program. And Lise is a, again, decades-long practitioner in the space of cancer risk reduction. So what we're looking at here is evidence-based, but it's also practice-based, and it's also nutrition and lifestyle, because one cannot supersede the other when it comes to cancer risk reduction. So for a moment, I'm going to pause, and I'm going to turn it over to Kathy to introduce yourself and to share. I'd love to sort of like why cancer risk reduction for you, personally your interest, and then secondarily, you've worked with a lot of individuals, and I think it would be helpful for us to sort of pivot into what their questions and needs have been, and we'll then talk about how this program supports that.
Sure. So mine stemmed from the fact that many years ago, 2009, when I was diagnosed with breast cancer, I was caught a little bit off guard because, after all, I live a healthy lifestyle, right? And so, as Lise often says, I think I was a healthy person that developed breast cancer. She did as well, same thing. And because I had the background that I did, I wanted to dive into the research about cancer risk reduction, but really risk of recurrence, reducing that risk, right? And I didn't, I knew a lot about cardiovascular disease because that's where my original education lies, but not a lot about cancer. But I also felt lucky not being diagnosed with breast cancer, but having the background to try to piece together what really would make a difference, So, and it's not really something you get from conventional oncology. They do their thing, and that's what they're focused on, and that's okay. But I, like almost every one of my clients since then, has said, what else can I do? Right? And a lot of times the oncologists will say, don't worry about it. Go back to you're done with treatment, go back to your life. And if anything happens, we'll catch it early. All right, well, because they're being followed. But that's not good enough for most cancer survivors. Some people, I guess, maybe, but for most, they want more because you feel like you're falling off a cliff when that happens, you have all these people watching you for months, and then all of a sudden they're not watching you. So I delved into the research and all of that, and put a plan in place for myself with the help of other amazing practitioners that I knew and had access to. That was sort of before the whole virtual thing. So they were, mostly local. At the time, I did not know about Dr. Lise Alschuler. I've since gotten to know her very well, and we're good friends. But at any rate, one of the things I did is I decided to put together a workshop, a 2-hour workshop. I think I called it Change Your Eating, Change Your Life After Cancer. And I pitched it to the Hartford Hospital Cancer Center. And they said, Department of Integrative Medicine said, sure, you can teach this. So great, I did that. And it was fun. I did it quarterly, but my takeaway from that is every time I taught it, someone or more than one person would say, everybody should have this information.
Mm-hmm.
Right? Not just people that have been diagnosed, and that always sort of stuck with me. And that's when you and I, started talking.
Mm-hmm.
I'm like, yeah, we have to do this because everyone should have this information.
Yeah.
So, the main thing I think for cancer survivors, though, is they all want to prevent a recurrence, but they're in a unique place in their emotionally, financially, all of those things. They're in a unique place. So it's very important when working with cancer survivors to meet them where they are and start from there. And that's the beauty of doing it this way and with health coaching.
Yeah. Oh, incredible. And, you're reminding me, I had a little bit of a different experience. My early exposures, thankfully, I feel quite fortunate, but I was working in a pediatric hospital, and, the recommendations were just get calories into the kids. And it was and it wasn't just get calories into the kids. It was also, you parents and caregivers, have to, your entire world is thrown off. And so a lot of them were eating in the hospital dining room, the vending machines, those kinds of things. And the notion that nutrition, just how profound a role of nutrition, and things like lifestyle, breathing, laughter, nature, those kinds. And it's been really incredible to see changes, especially in cancer facilities for children today. But one of the key focuses has been on the community. So part of the reason for us to open up this conversation before diving into the program and to share it this way is just to sort of pique all of your interest in recognizing that there's a huge area of opportunity. And the cancer risk reduction, as Wendemir said, she loves this tool, is a lens through which so many people are open to having conversations or analyzing or assessing their potential for change in terms of nutrition and lifestyle, as opposed to people who are maybe have been really frustrated, disenchanted by things like their, blood sugar or their, their weight or, any of these other things. And so one of the values of this program is it does really meet somebody where they are, and it allows us to go through it in a really meaningful way that helps us to, and the coaching involved in our program helps us to really have either if you are the coach that I'm talking to, or the practitioner who will have the coach working with their individual, really helps to turn around and say, let's not try to do all of this in 3 months. And this is a 3-month program. So that's, significant on that part. So let me take a moment and actually share my screen and walk through this. Kathy, as I'm sharing my screen, and if you want to chat about anything, please, feel free on that part to comment. I'm just going to be in here. So when somebody comes into our app, they have the opportunity to be messaging with their coach and receive messages from their coach. We also have different things that they're tracking, and they can see that data. And the coach has a different back end where they're able to see all of that And our clinical team, including myself and Kathy, are able to see that. And we also run the every other week clinical sessions, where they're group live sessions where people can come and ask for clarifications, et cetera. Keeping in mind that whenever somebody goes through a program, especially if they're your patient and you're referring them into the program, it's your recommendation. So if you wholeheartedly believe somebody should be keto or they should be vegan or whatever it is that we're working on for them, those are going to be your recommendations. So the program starts off with, and I thought I would open this, just giving everybody a calendar so that they can get a layout of how the actual program is going to work. So they'll be able to see on here, just on the different days, like, okay, I'm good this week, I'm going to be tracking the rainbow, or here I'm focusing on protein, or, oh yeah, I am going to get to omegas, so we can talk about that later. And the coach also has access to this, so they can remind, the participant, hey, we're going to tackle that at a little later point. It doesn't mean that things that are coming up later aren't on the table for discussion now, though, if somebody wants to talk about them, but just noting we have that. And then what we do from a welcome standpoint, this is probably the day that we ask them to do the absolute most. We bring in and we ask a series of questions so that we can get clarification on what they're looking for. And they watch a welcome video from me there. As it continues, I'm not going to show you every single slide on here, but we do things like explain not just about hydration, but why it plays a role in cancer risk reduction. So essentially, every step of the way, Kathy and I were looking at the content and saying, we know things that are important. We know people have been told things as it relates to their general health, but how can we focus it in on cancer risk reduction? And then let's see how we can help them optimize it. As you'll see, that's the focus of this week. So we've got water, we've got rainbow, and as we're going through these, we also have recipes within here. Kathy, I'm going to scroll down. I was trying to think if there was anything, something that's appealing to me. We've got a lot of nutrition and we're talking about that. It is interspersed with, things like cooking tips and et cetera. But we do also have lifestyle things like, okay, so things like checking in on your stress, looking at your breathing, exercise. And we actually have some really cool videos. If you want to share for a minute about your colleague who helped us with the videos for the breathing, that would be fun to hear from.
Yeah, I just knew that that week, that video shouldn't be me. It probably could have been you, but my colleague and friend Leslie Gordon has been teaching yoga and meditation and breath work for decades. And she's just she's so good at it. She's so approachable and just warm, and it's not at all intimidating. So I thought it would be fantastic to bring her in and have her sort of go through the different types of potential breath work that people could do, and then they can experiment with it during the week, see what resonates with them, what they like, what feels good to them. Yeah. Because there's no perfect way or right way or anything like that. And also to get across the point that it doesn't have to be a 20-minute session on a cushion, right? It can be 5 minutes here and there, and it's impactful. That's what the research says. So we brought Leslie in for that, which was fantastic. But down further, weeks further, when we talk about sleep and optimizing sleep and sort of going through all of the different possible things you could try, because there's so many. And again, you don't have to do all of them. Experiment with one or two that work for you, that you think, hey, that's low-hanging fruit. I can do that. That's easy. And then see how it goes. But during that week, we have Leslie doing a yoga nidra session, which I honestly wasn't familiar with until a few years ago when I did a program with her. And she did it. And I was, I was teaching with her, but I got to benefit from her yoga nidra sessions. And I thought, this is fantastic. It really does support sleep. So yes, we have Leslie in there, and that we're really happy about that.
And we also have another colleague of ours, Bree, who is a fitness expert. And so when we give examples of different fitness concepts, really around activity, and some ways to inspire and to experiment, with just some different activities. We also have some videos in there associated. So the concept is, in here, this really is a program about doing it. The program, you'll hear Kathy and I both use the term experiment. This isn't about a goal, there isn't a finish line on this part, but it's about looking at, from a lifestyle standpoint, what are the things that you can experiment to see with how in your day right now, you may be able to incorporate some of these things. What that does over the course of 3 months is it also allows you and your coach to navigate through changes that happen, in a month. So for a woman, it might be different based on her hormone cycle, or as you're leaving one season and approaching another season, or maybe as life challenges happen. Maybe there's one month where things are particularly stressful or financially very stressful, and another month where hopefully it isn't as stressful. And so as you're navigating these things, you start to develop strategies that and try things out for yourself to see what works for you, because at the end of the day, that's really what risk reduction is about, is being able to compile more of those tools that help you make better choices, more consistently on that part. So this program, are you doing them all live or recorded on demand? Great question, Wendemir. Yeah. So this program is in our app, and so this is on demand. It's technically live for them whenever they do it. They're obviously recorded sessions, but it's live also with their coach. So the way that our programs work is that if, Wendemir, you had someone that you wanted to sign up right now, they would pay you. They don't pay us. You pay our wholesale price, which is $375 for the program, but you could charge $500, or you might decide to charge $375 because it may be part of a package where they also have maybe a monthly session with you, where maybe you also are indicating what supplements you want them to take. Maybe they're doing this while you're, have tested. Maybe you're working on somebody's blood sugar, or you're working on, seeing if we can improve somebody's labs, or something like that. And so that 3 months might be a really nice time period, to see what changes can occur, and then you're retesting labs, at the end of that part. And if that's part of a package that you're putting together for somebody, then you just know your cost is $375 and your profit is everything that you generate off of from that package. So in that capacity, they would then, once they pay you, then you come over and you pay us and you sign up for the program with their information, and they come right into the program. And at that point, or prior to, we've assigned a coach to your practice. So, if whether it's, we've got plenty of different coaches with incredible experience on this part. And so there we would be choosing, asking you, do you have any particular desire for one type of person, one type of coach, or, anything like that. We'd match you with a coach, and then that coach will pick up the participant as soon as they come into the app. They'll have a meet and greet. They'll go over the calendar. They'll talk about that person's goals, and then we'll start in the program. And we interact with you, the practitioner, through an instant messaging. We use Slack, where if you have questions, how's my patient doing? What's going on in this? Or I received some new information. Or can you check to see if my patient has actually done the labs that I ordered? Or can you check if they're taking the supplements? So we really work as an extension of your practice to help make sure that your recommendations across the board are being implemented, but also to give you feedback where your recommendations may not be doable. A great example of that is Kathy was just talking about breathing. And if somebody, if they've identified that waking up in the morning, brushing your teeth and then doing some breathing that's a great time for them. If we've given them something else to do at that time period, then those would be in conflict. And then we would talk to you about, hey, what do you objectively, here's what we're seeing. Or, the person was trying to get rid of all dairy, but they're just not willing to get rid of cheese. So can we give them some different recommendations around cheese? Here's what we were thinking. And so that in real time, we're able to adjust the participants and have them have a better experience, because they'll feel more successful continuously if it's collaborative on that way. Kathy's nodding her head. Yeah.
Yeah, I was just going to say, and they won't give up, because,
right,
when they get frustrated with the cheese situation that I'm not supposed to have any, sometimes, we humans then say, oh, the heck with it. I'm just not going to do this anymore. And I'm going to eat all the cheese I want. Doesn't matter. Whereas when working with the coach, we can talk about, what's your favorite cheese, and can we get the best quality? And then let's talk about portion size and how many times a week and what's acceptable to you. So working with the coach is really important there, because it keeps them moving forward in a way that feels easier.
Yeah. And one of the things that I love about this program is it also surfaces other areas of exploration. And remember, this is a journey that your patient is going, you guys know this, but hopefully this is a journey that your patient is going on with you. And so, some of these things we will have firsthand awareness if their digestion is really the factor. Or if something else is going on, we're going to get clarity of that. If we're seeing consistently that they're really struggling with sweet taste bud, with cravings, then coming out of this, the better next step may be, hey, let's actually hone in on that. Let's focus on that. If it was really hard for you to stick with your, with the restricted amount of added sugar, or I hate the word restricted. I've been working on a plan today, and I keep using that. I'm saying we're not using that word, and all that's done is stuck into my head. But a limitation, or looking at trying a reduction. And if somebody's really struggling with that, we're going to be able to see and advise you that that's a good next step for them. So it's about, one of the things we do at Better Nutrition Programs is we work with you, the practitioner, to then be able to say, here's where we think that person should go next. And, oh, by the way, here's what they're interested in doing. So it really helps in that maintaining that client retention, because we're already seeding the concept along the way of there's something more that we can do working together. And sometimes that's just working with your coach. It may go from where we were working more intensively, messaging and, meeting every other week and, these kinds, or a couple of times during the program. And then afterwards, they may say, you know what, I really enjoyed that check-in. I'd like to, over the course of the next, 4 months, I'd like to meet with my coach one time, or I'd really like to maintain access, because when they do that, they still can come to the group live sessions. They still can have that messaging. So it really is a way to have personalized nutrition as an extension of your practice, whether you're a dietitian, whether you're a doctor, whether you're a naturopath. The things that you shouldn't be spending your time on, or things that you don't have time for, in some instances, maybe the things you aren't even trained in, these are going to be the things that they will have access to, that we're able to provide.
And Ashley, I just want to say real quick that it is pretty darn common for people that have gone through conventional cancer treatment, to really have gut issues for obvious reasons,
Yeah.
right? It can definitely do a number on your gut. So, we will then, in the very near future, I don't think it's live yet, right? But we'll have the microbiome optimizer.
Correct. We have our digestive tune-up, which is live, but our microbiome optimizer. And the tune-up is a great, again, that's a great area to be able to go. And then for somebody that needs the more intensive, Kathy's absolutely right. So this, it's a great, and I was just talking to somebody this morning who is building a membership for her practice, and we're incorporating in one program a quarter. So, and that, she was like, this is perfect. In that capacity, somebody can choose to do either cancer risk reduction, or they might start small and do Rainbow Challenge, that kind of thing. So this may be opening your eyes to the programs, depending on if this is the first time you're catching us or if you've caught us before. And if you have any questions, please join me or my colleagues for a demo. You can just head over to the website and you can demo, and we can show you the content as it relates to any of the programs, or talk more specifically about how the programs work within your practice. Reminder, if you are a member, if you're a BNP member, an active member, you actually have a discount on the programs. What that means is your wholesale cost is even less on that part. So if you're interested in signing somebody up, just make sure you get that code from your membership and use that on that part. And then whatever you're billing at, of course, you can choose the pricing on that part, as I was mentioning earlier. So I think we'll, unless there are any other questions, I had answered a few that Wendemir and some others had asked, but this is a huge opportunity, and I think the education in here is put together in a way, of course I'm biased, but we talked a lot about what are the other programs that are out there and what's often missing, and even the order, how we structure the order of what people are doing to have it feel like something that they can be really successful in. So, it's my hope that that's this is a very positive experience. And it's one that I also, to be thinking, one of the reasons we wanted to come out with this now is for you, as from a business planning standpoint. October, of course, is Women's Health Month and breast cancer awareness, although we're all aware of breast cancer, but it's a big month around breast cancer and women's health. November is with men is prostate cancer. I think there's something related to cancer all the time. But one of the things that you can be thinking about is that this can be a program that you can choose to offer in those time periods. And the great part about that is it gives your participants a coach, both pre and going into the holidays. So somebody's doing it October, November, December. What a great time period, or somebody's doing it November, December, January. What a great time period on that part. So really some good options for you on that part. And Kathy, I'm just so excited. I know it's been a labor of love. It took us a bit, but I also just want to remind anyone who has our toolkit. So you have the cancer risk reduction evaluation. That is a great lead magnet to bring somebody into this program. So when they go through and they fill that out, and if there are things that they're not doing or they're doing maybe that are factors in here, you're like, oh, you can come in. This is going to be a program where you'll get information on personal care products, where you'll get information on your cooking, on your eating habits, on, you know, all these different things. And I think that'll be, you know, very helpful for them as well. Yeah.
And Ashley, I just want to add, you know, I have to add this, that we did take a deep dive in this program into decreasing the body's toxic burden.
Yeah.
And that just makes me very happy. And so
yeah.
I'm very
and
excited
supporting the body's detoxification system. So it's like, let's do both of those, right? Let's recognize that your load can't be so high that you can't, like, that the body, like, no matter how awesome your detoxification system is, it's not going to be effective if the load is just so high. And so what is within our control and what steps can we take? And that's where, you know, that was really why we created the tool of this month. If you're watching this in July of 2022, which is the personal care guide, textiles, cleaning products. And we've heard from just incredible experts, Amy Ziff and yesterday Marcy Zaroff, on just why this is so important for us as well as for cancer risk reduction. You know, what we choose to use and where, et cetera, is going to have massive impact on the levels of cancer in subsequent generations. And so this is this whole, like, play it forward that I'm going to pause because I can go down a hole on that one, and I want to move us on that piece. If you have any questions, please reach out or drop them here. If there's anyone you think that they should see this video, let us know. We're happy to share you the link and have that shared out. And this will also be in the for our members in your video library, so you'll also have access to it there. Thanks, Kathy. I appreciate you.
I appreciate you as well. You're
excited.
Welcome.
Take care. Okay, bye.
Take care. Bye.